One interesting phenomenon for people after a stroke is that they may experience a decreased awareness or attention or even the existence of one side of their environment or their body. For example, for some patients after a stroke, especially for the left side of their body, they may completely forget about their arm and they may be like caught up in like awkward or unsafe places and they may not even notice and they may not even feel it too, because after a stroke they may experience a numbness. Unfortunately, this often goes unnoticed by the patients themselves because they're the ones who are experiencing this left inattention, left neglect of their body, this deficit. And it's often family members who are the ones who detect this and notice this, like, hey, like, why are you leaving your arm like to the side like that? Or why is it in a funny position? Why is your leg like in that position? Why are you bumping into things? Another common thing with this left inattention and left neglect is that patients may bump into objects when they're walking around, such as in the doorways or like walls, and objects that normally people would notice and like go around or avoid, but for patients after a stroke, they may just straight up bump into it. After a stroke, there are some changes to your brain. And our brain has kind of like a map of our world and our body, like our awareness and our perception of it. Like, I don't need to tell you where your left arm is. Like, if you just think about it, you can just raise it up, or your right arm, you can raise it up. Like, for those of you who have a stroke, you may have more difficulty with that. And similarly, our world's perception and awareness of our body is kind of built into our brain. And after a stroke, there has been some changes, an infarct, some blood loss, loss of oxygen, some changes in that brain tissue that causes it to not work so well anymore. A lot of times after a stroke, many patients, people, providers, therapists, doctors, they focus on the really obvious, and that's like one's like weakness with their arm. They're not moving it, like it's just not moving, or their leg, or for a lot of other patients, they can't walk, or maybe their speech is affected. And not that all these things are not important, but just to be holistic and to address the whole person, because they're experiencing all of these symptoms, is not just these obvious symptoms, these physical obvious symptoms, but also what is more invisible. The patient's inattention and their lack of awareness, their neglect of one side of their body. And most commonly, the research is showing those who have had a stroke in their right side of their brain affects their left-sided awareness. So left inawareness, left inattention, left neglect. And these terms are often kind of used like interchangeably. There are like kind of distinct differences between them. But for you, the patient or the caregiver or the family member, what you should know is that this phenomenon even exists in the first place because it has functional implications, right? Patient is not aware of their environment when they're crossing the street and the car is coming. You know, we're trained to look left, right, and then left, right? If the patient is not even aware that their left side is existing, they're crossing the street, that can be very dangerous. So what can we do about it? And one cool mnemonic that I'm going to teach you today is SEAL, S-E-A-L, like the cute little animal. And I want patients after a stroke to really repeat this in their head before they do any major movements until it's really kind of ingrained in their mind and they're really doing it automatically. So after a stroke, in the very beginning, we'll kind of have to be really intentional and put a lot of mental energy into thinking about this before we even move. And it just takes a split second because you remember this mnemonic to go through it in our head. However, it takes a lot of repetition and doing it every single day. And until it becomes so automatic that you don't even need to think about it and you're doing it kind of like unconsciously, then you don't need to worry about it and use it as much. And that's the goal, right? With all of stroke recovery, it's repetition until it becomes so automatic that we don't have to focus on it and use so much kind of mental energy and thinking about it in our conscious, like mental, thoughts that we can do a lot of other things. So with S is surroundings, another kind of S to go along that is shoulders. You ever been to like when you're traveling or you're like at a zoo or you're just at a hill and like really cool like touristy place, they have those binoculars, right? Like at the very edge of like the railing, and then you can like put some coins in. I think they still exist, right? They're still around. I still see them around. And you can use them as like binoculars to look really far away, right? And they have like a fixed kind of rotation, right? Kind of like a tripod, like another similar analogy is it goes and you can look from here to here. However, these are kind of fixed, right? They aren't like rotatable 360 degrees. You can't turn it all the way around and look at, well, what we don't really care about, right? Like the scenery is like out in the front. It's probably like, I don't know, like 180 degrees. So what happens with patients who have left inattention and left neglect is that that rotation is fixed even more. It may not be necessarily the full 180 degrees. So it's not that they can't do it physically, but mentally it's fixed for them. So if you were to ask a patient to look left and then they stop, that's kind of like a mental thing in their awareness and like kind of how they're calibrated. However, if you're gonna physically ask them like, I think you can turn your head a little bit more, right, Mrs. Jones? Then they could, yeah, look a little bit more, and then they'll be like, oh, whoa, I didn't even know like that exists. Like, oh, where did that come from? With that, S is for shoulder. So that's a really good cue to look in our surroundings from like left to right, but to look all the way to where our shoulder is. So if my shoulder is over here, I'm not just looking to my left and, okay, I noticed this in my environment, but also looking all the way to where my shoulder is, both on my left side and on my right side, so that I'm getting that full, taking in what's fully in my environment. So what's E? E is basically the same thing as surroundings. I just kind of want to make the mnemonic work and sound nice and like make it get pronounceable and turn into cute little seal. So surrounding, environment, same thing. Okay, what's A? This part is pretty easy and straightforward. It's arm. Where's my arm at? And when you think of arm, it's your stroke arm most typically. You're not going to have any trouble, most likely more than not, with your non-involved normal functioning side. It's mostly, after a stroke, what's going on with my arm. So is it stuck and wedged in between the bed? Is it caught in like the wheelchair wheel, or am I like sitting on it? Is it bent funny? Basically, does it look normal? With that said, what's the L? L is your leg. So not only checking our arm, but also checking where our leg. Where is our leg? Is it caught under something? Is it twisted funny? Is it bent funny? Does it just not look the same as my other body part, which is my right leg? So a good thing is to kind of mirror your leg for your stroke involved side with the L in seal for leg, is to check, is it like kind of symmetrical? Typically, that's a pretty good rule of thumb for both of our legs to be in a comfortable position. So with seal, it's check our surrounding, and from shoulder to shoulder. E in the seal is for environment, so we already checked that off. A is for arm. Where's our arm? And a good thing for patients after a stroke is to place their arm comfortably and resting it so that it's doing something. Now, so that it's not, we don't want it to be dangling and just kind of like that. We don't want to be wearing a sling 24/7 and having it locked up in this position, causing more muscle tightness and decreasing our range of motion and how far it can move. We want it to be actually doing something. And even if we're sitting idly and like watching TV or on our phone or something, we can give it a job to do and kind of stretch it out. So you can either be putting weight through it and kind of giving it a job to do that way, such as like how when we're standing, it's good to put weight through our hips and our knees, right? Same thing, we're putting weight through our shoulder of our stroke arm. If not, at the very least, you could be stretching it. So bringing it out to the side, because oftentimes after a stroke, arms can be locked up to the side like that, or could they be kind of dangled to the side. You can kind of open it up and bring it out and stretch it that way. So that way we're counting for our arm. And similarly for our leg, that's a really simple one. Check to see if it's symmetrical with your other leg that's not having the stroke, that hasn't been affected by the stroke, and that's your seal checklist. So as you can see, after a stroke, one thing that is an invisible kind of condition, deficit that not many people talk about, except probably therapists, because they notice these things or family members, is their inattention or lack of awareness to one side of their body. So with the seal mnemonic, it helps for patients to repeat it themselves, and if you're a caregiver, to kind of repeat it to them. Hey, are you doing your seal? Kind of like that. It can be a cute little thing, you know, and so that you can empower patients to be like, oh yeah, I'm not checking myself and not checking my surroundings fully from shoulder to shoulder. I'm not checking my arm or my leg enough. And the more you do it, the easier it becomes. And the goal is that it's more ingrained in your brain and it's so automatic that you don't have to think about it, and that you can do much more things without putting as much energy into it. And so you can get on with your life and your recovery and live a more fulfilling life after a stroke. So if this tip has been very helpful, as this is YouTube, give it a thumbs up, subscribe. You know how to do those things with YouTube. I really appreciate it, so that I can make more videos. And I know that these videos are being watched and they're kind of helpful and providing value to you guys, especially you patients out there after a stroke. So thank you so much for watching. Remember to do your seals and have a nice day.